Chapter 7 of ICD-10-CM is for diseases of the eye and adnexa. This presentation will cover the official ICD-10 guidelines specific to this chapter. There will also be clinical scenarios to practice coding what you just learned, followed by a small quiz at the end of the presentation. For each coding example, you will need to pause the webinar and use your ICD-10-CM coding manual to code the scenario. Once you resume the webinar, we will go over the correct codes, the rationale behind them, as well as how to locate them in the ICD-10 manual. Keep in mind that there may be more than one way to find a code. We are aware that there is a great deal of information contained in this presentation. Therefore, at any time during the webinar, please feel free to pause and replay as needed. It is important that you have already completed the Introduction to ICD-10-CM webinar, as you will use the conventions and general guidelines discussed in the introduction to complete the coding scenarios. As you can see on this slide, the codes for this chapter start with the letter H. If you remember from ICD-9, these codes all started with number 3 and were part of the nervous system chapter. ICD-10 created a separate chapter for diseases of the eye and greatly expanded the number of codes due to increased anatomic specificity, including laterality, which is extremely important for coding conditions of the eye. One more change from ICD-9 is that the term senile is no longer used for cataracts. The new term is age-related. For glaucoma, which is category H40, codes may include the type of glaucoma, the eye affected, and the stage of the glaucoma, which is designated by a 7th character. If the patient has glaucoma in both eyes, you may have 2 codes. If the patient has bilateral glaucoma of the same type and same stage, you're only going to use 1 code, which will include the type of the glaucoma, the location, and the stage, such as H40.33X1, which is glaucoma secondary to eye trauma, bilateral, mild stage. So that 1 code is telling us not only does the patient have glaucoma in the type, which is secondary to eye trauma, the location, which is bilateral, and the 7th character of 1 is for mild stage glaucoma. However, there are some glaucoma codes, including H40.10, which do not have an option for bilateral. Therefore, you're going to report 1 code for the bilateral glaucoma when both eyes have the same stage and same type of glaucoma, such as H40.10X3, which is unspecified open-angle glaucoma, severe stage. So there's no option for the H40.10s for right, left, and bilateral. So if the patient has the same stage in both eyes, you're just using that 1 code, which is H40.10X3. Now let's talk about a patient who has bilateral glaucoma, but the type and/or stage is different. If the patient has low tension glaucoma of both eyes, so same type, but the right eye is moderate stage and the left eye is severe stage, you would use 2 codes for this patient rather than the code for bilateral low tension glaucoma. The first code reported should be the more severe stage, which in this example would be H40.1223 low tension glaucoma, left eye, severe stage, followed by H40.1212, again, low tension glaucoma, but now we're saying it's the right eye and it's moderate stage. Now, if we have a patient with glaucoma in both eyes, but each eye is a different type, 2 codes will be needed for the 2 different types of glaucoma, such as H40.10X1 for unspecified open-angle glaucoma, mild stage for 1 eye, and H40.20X1 unspecified primary angle closure glaucoma, mild stage for the other eye. Finally, for bilateral glaucoma, if the code does not indicate laterality, such as the open angle closure code we discussed with the previous slide, and the patient has a different stage of the open angle closure glaucoma in each eye, you're going to assign 2 open angle closure glaucoma codes, one for the specific stage of each eye. Therefore, you'll have 2 codes that are the same, other than that the 7th character for the stage is different. The more severe stage code should be reported first. Now I'd like to try some examples for this chapter. First, we have a patient presenting with severe stage primary open angle glaucoma of the left eye. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The answer is H40.11X3 for primary open angle glaucoma, severe stage. You're going to start by looking up glaucoma in the alphabetic index and then locate open angle indented below. Indented under this is the term primary, which points to H40.11 with a checkbox next to it indicating that more digits are required. After finding H40.11 in the tabular, there is a symbol indicating that a 7th character is required from the box above for the stage of the glaucoma. Since documentation states that this patient's glaucoma is severe stage, a 7th character of 3 is appropriate. As the code is only 5 characters in length, H40.11, but a 7th character is required, an X placeholder is needed in the 6th character position, so that our stage can be in the 7th character spot. You'll notice that even though documentation also states that the glaucoma is of the left eye, that laterality is not specified for primary open angle glaucoma. Our next example is a patient with glaucoma due to bilateral central retinal vein occlusion. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is H40.53X0, glaucoma secondary to other eye disorders, bilateral, stage unspecified. Start by looking up glaucoma in the alphabetic index and then locate the word in indented below. Indented under this is retinal vein occlusion, followed by a note which states see glaucoma secondary. After locating secondary indented below glaucoma, none of the options specified below secondary are appropriate, so we must use the code next to secondary, which points to H40.5, with a checkbox next to it indicating more digits are required. After finding H40.5 in the tabular, we see that the code for bilateral is H40.53, with a symbol indicating that a 7th character is required from the box above for the stage of the glaucoma. Since documentation does not indicate the stage of the glaucoma, a 7th character of 0 must be used for unspecified stage. The 7th character of 4 for indeterminate stage is only to be used when documentation specifically states that the stage cannot be determined. As the code is only 5 characters in length, but a 7th character is required, an X placeholder is needed in the 6th character position. We know that we need another code as the instructional note in subcategory H40.5 states code also underlying eye disorder. Therefore, the second code is H34.813, central retinal vein occlusion bilateral. You would start by looking up occlusion in the alphabetic index and then locating the word retina indented below. Indented under this is vein, with the word central in parentheses, which points to H34.81 with a checkbox next to it indicating that more digits are required. After finding H34.81 in the tabular, we see that the code for bilateral is H34.813. Our next example is a 62-year-old hyperopic woman with family history of angle closure glaucoma, previously noted to have an intraocular pressure of 23. After an exam, the physician diagnoses mild stage narrow angle glaucoma of both eyes. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The answer is H40.20x1, unspecified primary angle closure glaucoma, mild stage. Start by looking up glaucoma in the alphabetic index, then locate narrow angle indented below, which is followed by a note stating see glaucoma, angle closure. After locating angle closure indented below glaucoma, none of the options specified below angle closure are appropriate, so we must use the code next to angle closure, which points to H40.20 with a checkbox next to it indicating that more digits are required. After finding H40.20 in the tabular, there is a symbol indicating that a seventh character is required from the box above for the stage of the glaucoma. Since documentation states that this patient's glaucoma is mild stage, a seventh character of 1 is appropriate. As the code is only 5 characters in length, but a seventh character is required, an X placeholder is needed in the 6th character position. You'll notice that even though documentation also states that the glaucoma is for both eyes, laterality is not specified for primary angle closure glaucoma. Our next example is a 28-year-old male presenting to his physician with bilateral eye pain. His condition is diagnosed as non-ulcerative bilateral blepharitis of the upper eyelids. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is H01.001, unspecified blepharitis right upper eyelid. You would start by looking up blepharitis in the alphabetic index, which has the term non-ulcerative listed next to it in parentheses as a non-essential modifier. The next term to look for is right or left, as the patient has this condition bilaterally. I chose to code the right eye first, therefore I then found the term upper indented below for the upper eyelid, which points to H01.001, which you would then confirm in the tabular. Upon confirming your code in the tabular, you will also see the code for unspecified blepharitis left upper eyelid, which is H01.004. Since bilateral isn't an option for blepharitis, 2 codes are needed to indicate where the condition occurred. It does not matter if the right or left eye is reported first. Our final example is a patient presenting to his physician with continued eye problems following cataract surgery. Ultimately, this is diagnosed as bullous keratopathy, left eye, due to cataract surgery. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The answer is H59.012, keratopathy, bullous aphakic, following cataract surgery, left eye. You would start by looking up keratopathy in the alphabetic index, and indented under this is bullous following cataract surgery, which points to H59.01 with a checkbox next to it indicating that more digits are required. After finding H59.01 in the tabular, we see that the code for left eye is H59.012. Now it's time for our quiz. Our first question is, if a patient is admitted with glaucoma and the stage progresses during the admission from moderate to severe stage, what stage should be coded? Our second question is, what is the code for luxation of globe of the right eye? You can pause the webinar to write down your answers and then hit play to find out if you were correct. The answer to our first question is severe stage, as you want to report the most critical form of the condition. The answer to the second question is H44.821, luxation of globe right eye. To locate this code, start at luxation in the alphabetic index, and indented under this is globe, non-traumatic, which points to H44.82, with a checkbox next to it indicating more digits are required. After finding H44.82 in the tabular, we see that the code for right eye is H44.821. Remember, the United States will begin using ICD-10 on October 1st of 2015. After the October 1st compliance date, it will be very important to verify that claims are being received and to check remits for denials based on the ICD-10 conversion. This concludes Chapter 7 of ICD-10-CM, Diseases of the Eye and Adnexa. Please feel free to check out our webinars on all 21 chapters of ICD-10-CM. If you need further assistance with ICD-10 training for physicians and/or staff, please visit the VantagePoint website at www.vantagepointconsult.com or call us at 203-288-6860.